My name is Sandro Galea. I have the privilege of serving as Dean of the WashU School of Public Health. Welcome to Public Health Ideas. These are conversations that aim to highlight work that is relevant to public health from faculty across WashU. Today, I have the privilege of speaking with Professor Lora Iannotti. Professor Iannotti is a professor at Washington University Brown School of Social Work. Today, we're going to be discussing her recent paper in the journal Current Developments in Nutrition called Wild Foods Are Positively Associated with Diet Diversity and Child Growth in a Protected Forest Area of Madagascar. I'm looking forward to the conversation and to learning from her. Lora, welcome.
Thank you.
Tell me a bit about this work. Tell us about the background as to how you came to do this work.
So truthfully, I wasn't looking to add another country to my portfolio. I think sort of philosophically, paradoxically, to do impactful global health, you have to focus, especially if it's community level work. And I already had several countries in the mix. But the Missouri Botanical Garden came to me. They needed somebody from WashU to partner on a grant with the Living Earth Collaborative, and they invited me to join this project in Madagascar, where they were looking at the use of wild plants and the conservation status of those plants, and whether or not they were threatened during hunger season. So I looked a little bit into Madagascar, into the statistics, and I found that the nutrition statistics, the malnutrition statistics were appalling. Very high prevalence of chronic malnutrition. So it was sort of this convergence of an interesting research question, a delightful Missouri Botanical Garden team, and then a dire need that convinced me to do this.
Tell us for 2 seconds about the Botanical Garden and their group of scholars.
So the Missouri Botanical Garden has a lesser known, but actually world-renowned research group. It's one of 5 top gardens that do research around the world. In Madagascar, they're discovering plants every time you turn around. It's a biodiversity hotspot, so naturally you're going to find a lot of new plants, but it's really a stellar group of people. It's called the Brown Center, the William L. Brown Center, and it's filled with ethnobotanists and botanists who are doing really interesting work.
Sounds like a really interesting interdisciplinary work. Tell us about Madagascar now. Tell us a little bit about why malnutrition is so prevalent there.
As I mentioned, the statistics are really very concerning. There's 40% of stunted growth, which is a form of malnutrition that's chronic and related to poverty and infectious disease. But even more alarming is the prevalence of wasting or acute malnutrition, which is reaching famine levels. It's at 7.7% nationally, but in the communities where we're working, it's at 18%. You never see it that high. I would say, though, it was the field visit that convinced me that this problem is really widespread and serious. So it was an isolated community, and the children, I saw forms of malnutrition I haven't seen in years, like kwashiorkor.
Really?
Yeah.
And what's driving that? Like, why is there so much malnutrition? Is this linked to the climate crisis, to biodiversity challenges? What's driving all this?
I think first and foremost, it has to do with just entrenched rural poverty.
Right. Okay.
So 80% of the population live in rural areas, very remote and disconnected from healthcare systems, vaccinations, and so forth. But then climate change, as you said, is really inflicting a lot of harm in the communities too, mostly drought that's causing the problems.
Let's shift to your paper now. Your paper is about wild foods, which I think one might think we know what they are, but tell us a little bit what they are from a scientific perspective.
Yeah, so the definition of wild foods, it's pretty simple. It's any non-domesticated flora, fauna, fungi. You can harvest, you can dig for tubers, you can harvest berries, you can forage for mushrooms, and that's all considered wild foods. In the situation of Madagascar, during hunger season, which is the time when people are planting or waiting to harvest foods, they are going into the sacred forest. It's a protected forest, and they're finding a variety of different wild foods.
Now, tell us a little bit about your paper, and what did you find about wild foods?
We found, actually, it was somewhat heartening, that child dietary diversity was improved with these wild foods. So we found that they were giving the children a whole mix of different kinds of tubers and leafy greens, But actually, it was the wild animal foods that probably was most protective for their health and nutrition. So they take from the river crawdads, crawfish, tiny fish, shrimp. They also eat insects in Madagascar, and all of that was found to be protective for child nutrition and growth, in fact, in the kids.
One of the comments I thought was very interesting in the paper was when you spoke about our growing awareness of the dangers of eating wild meats, for example, and particularly because of infectious disease outbreaks in the context of COVID. But while that might exacerbate challenges with malnutrition, talk a little bit about that, about the reality on the ground, about these kind of restrictions and solutions, if there are any.
Yes, so my lab focuses a lot on animal source foods because animal source foods are, it's a high quality food with bioavailable nutrients, and people often in these very low resource settings don't have access to animal source foods. So game meat is a really good example of one that can really inflict food insecurity in these populations. It is a concern. I think we have to think about zoonotic disease and consider One Health. But approximately 1 billion people around the world actually supplement their diets with wild foods. I was surprised to learn that myself.
Yeah, I thought that was actually quite remarkable.
Yeah.
What you engaged the community in this work. Tell us a little bit about that. Tell us about what the community engaged work like this looks like in Madagascar.
Yes, so we have a stellar Malagasy team, and this is the case in all of my countries, where I have field teams of people who come from the country, often come from the context or the communities. So they speak the language and they have relationships with these communities. And it's really important that they spend time, and they do. Right now they're in the field for a larger public health project, in fact. Talking to the community members and figuring out what's going on with their attitudes and perceptions, and just sorting through what the problems are and how they can address them. It's how you do good community engaged work, I think.
Can you give us a peek as to what the larger public health project is?
Sure. It's a larger public health project that has been funded by a private donor who is a leader at WashU, in fact, in the Goldfarb School of Nursing. And it's very holistic in nature in that we are looking at several different public health outcomes, which is really good to hear and good to know because it's not just nutrition. It's malaria, it's, kids are not getting vaccinated. It's the whole spectrum of public health problems that you can imagine. So the team is now in the field. They're collecting baseline data, and we've designed an intervention that includes access to safe water, because water, sanitation, and hygiene are also an issue. And they will be distributing bed nets. They will be providing logistics to get access to vaccines. So it's very holistic, and it's
terrific. What are implications of your work broadly for nutrition globally?
Well, first of all, I am not a fan of fortress conservation. I'm not sure if you've heard of this term.
No, tell me about it.
So fortress conservation basically means you barricade nature. You keep humans out of nature. I don't think that's practical. I think community-based conservation is a better approach to this. And in the end, we're animals, we're primates, and we live within ecosystems and eat in trophic levels and across complicated food webs. So we have to figure out how to exist again with respecting these ecosystems. I think we need to turn to Native Americans and indigenous communities and the foodways of past. We need to look at gatherer, hunter, fisher diets. But recognize in both of those cases that those populations are marginalized. And they've been pushed off land that is actually going to sustain them and feed them well. So in the end, we need to transform our food systems. We need to think about eating more locally. It's not practical that we all consume wild foods. But we can eat locally. We can source our foods from native and sustainably grown foods, and think about supply chains and how we really transform these food systems.
Are you hopeful in the context of climate change and the number of challenges the world's facing right now? Or what gives you hope, perhaps, another way of putting it?
I'm always hopeful. I think there's been a lot of really positive changes in Europe, for example, for food systems there, and they're figuring out how to eat with more respect to these ecosystems. I think in the U.S. we still have a long way to go, and we need to ensure that all populations, not just sustainable and healthy diets, but it's equitable. We need to figure out a way to ensure that people around the world, all populations, have access to these foods.
My last question is, did you get to see any lemurs in Madagascar in the wild?
Yes. Yes. In fact, in the place where we're working, there's about 6 different lemur species. Really? But they're kind of shy, so I went to a lemur park. Yeah. But we're actually doing some research, another project, where we're looking at predator-prey relationships and human interactions and how that affects that predator-prey. And it's the lemur and the fossa that we're studying.
Oh, so interesting.
Yeah.
Thank you for joining. Thank you for the work you're doing. And thank you for being part of the conversation.